Hello, and welcome to the I-65 3 in 30 webinar for March 2017. This month's topic is Working at Age 65, How to Avoid 3 Costly Medicare Mistakes. Our presenter this month is Diane Omdahl. For more than 30 years, Diane has kept her finger on the pulse of the ever-changing Medicare regulatory world. She's a registered nurse who launched her first company in the basement of her home and grew it into the nation's leading provider of Medicare-related training and education for home health care agencies. Over the years, Diane has delivered more than 400 Medicare-related audio conferences and 100 in-depth two-day seminars, making her a very experienced and very highly rated Medicare speaker. Diane has been featured in national publications such as The Washington Post, The Wall Street Journal, CBS Money Watch, Kiplinger, the American Journal of Nursing, and many more. With that, I'd like to welcome Diane Omdahl.
Thank you and welcome. Our 3 in 30 audio conference today is going to focus on a topic that is creating many problems for people turning 65, and that has to deal with those who are working at that magic milestone. We're going to look at 3 costly mistakes and what we can do to prevent them. And to begin, let's go back in time to the start of Medicare. On July 1st, 1966, the first round of Medicare beneficiaries were born in the year 1901. At birth, they had a life expectancy of 45 years. So when they got to age 65, they had already achieved more than they could have expected. At age 65, they did qualify for full Social Security benefits. However, over 56% of them would not have health insurance at the age of 65. And that was one of the prime forces behind the implementation of Medicare. With Social Security, full benefits, and Medicare, they had some financial stability. I read in one source that about 65% of the workforce in 1966 over the age of 65 exited and went into retirement. Now let's fast forward to Medicare today. The life expectancy of the baby boomers turning 65 is almost 80 years. With that increase in life comes a dramatic rise in chronic conditions. 8 of every 10 people turning 65 is living with at least one chronic condition. 50% of them have 2 or more. You may have read the estimates of the healthcare costs for the remainder of their life being at about $250,000 to $300,000. So this financial concern is causing most of them to continue to work. They don't qualify for full Social Security benefits until they are 66, and so they are working. And because they are still working, they face greater risk for Medicare mistakes. This chart from the Bureau of Labor Statistics shows the dramatic increase in people turning 65 who are still on the job, and they expect that graph to continue to increase. Now, the fact that they're still working puts them at risk for some problems. And the first risk is the notion that once you turn 65, you must enroll in Medicare Part A hospital insurance. I have heard this from many, many clients. Everybody's told me to enroll in Part A, so I did enroll. Here's a source from the Social Security website. You should sign up for Medicare Part A 3 months before your 65th birthday. Now, fact is, enrollment in Part A is mandatory only for those who are receiving Social Security benefits. If a person signs up for benefits before the age of 65, he or she will get a Medicare card in the mail a couple of months before the 65th birthday because they have been, or he or she has been enrolled automatically in Medicare. This leads then to the first mistake. Enrolling in Part A while still working and contributing to a health savings account. Those who are enrolled in Medicare are no longer eligible to contribute to an HSA. And this is a fact that some people do not know who are still employed. Here we have Maria, age 66. She did as she was told at age 65 and enrolled in Part A. But she had a high deductible health plan, and she did not know that being in Medicare made her an ineligible contributor to an HSA. Consequently, those contributions for the last year are considered excess, and they are subject to a 6% excise tax. These contributions are not deductible. If Maria's employer has been matching some of her funds, the employer probably will want that money back, and there could be other problems. A little bit more about a health savings account. We know, of course, that people enrolled in Medicare are not eligible. People who are enrolling at age 65 must prorate contributions. Not only do they have to stop the contributions, but they must prorate them. So, for example, somebody enrolling in June, that's half of the year, could contribute half of the allotment of HSA funds for that calendar year. Anything more than that would be considered excess. Once enrolled in Medicare, a person can use the funds for any qualified health care expenses. So in Medicare, that would be Part B premiums, the drug plan premiums. If there's a premium for the Medicare Advantage plan, any co-payments or co-insurance, out-of-pocket expenses. All of those are qualified except for Medigap premiums, or the premiums that they pay for Medicare supplement insurance. If a person enrolls after full retirement age, and for today's beneficiaries that is age 66, they should know about Social Security's policy on retroactivity. And again, this is something that has caught many of our clients in a trap. If you are enrolling in Medicare at age 67 and a half, Social Security will backdate that effective date to age 77 up to 6 months prior. Any funds that were contributed during those 6 months would be subject to the penalties we discussed. So experts recommend if you're going to be enrolling in Medicare past full retirement age that you stop contributions to an HSA up to 6 months prior. Now, another risk. We talked Part A. Let's look at Part B. There are many twists and turns about when to enroll in Part B, and again, people can get caught in a trap. For example, here's a little quote from Medicare.gov. When you're first eligible for Medicare, you have a 7-month initial enrollment period to sign up for Medicare. So we are being told we've got this opportunity to sign up without penalties. And then we can also read that if we do not enroll when we are first eligible for Medicare, we can be subject to a late enrollment penalty. So we should sign up when we're first eligible. If we don't sign up, then we're looking at a late enrollment penalty. And then to make things even a bit murkier, you can delay Medicare Part B enrollment when you're first eligible if you have group health coverage. Now this is from a popular website providing guidance to seniors, and you can find this similar language in many, many places. So enroll when you're first eligible. You face a penalty if you don't enroll, and you may be able to put it off. So try to figure out how that pertains to your individual situation. And with some of our clients, they did not have very good luck. The facts about Part B enrollment. Yes, indeed, there is a Part B late enrollment penalty. Second fact, some, but not all, who have an employer group health plan can delay enrollment in Part B. And finally, the decision as to whether or not to enroll in Part B depends upon the size of the company that is sponsoring the employer group health plan. Now, how does that work? A company with 20 or more employees, by law, that company must offer the same benefits to all employees. That company cannot change the premiums, the costs, or the coverage for any Medicare-eligible individual, meaning somebody 65 or older, or dependents of that Medicare-eligible individual. That company cannot offer incentives for 65 and older individuals to drop the coverage and enroll in Medicare. So in other words, if you are working for a company with 20 or more employees, you have the right to have that coverage. In this particular situation, Part B enrollment is not only optional, but it is not the best course to take, and we'll look at why. Mistake number 2, enrolling in Part B when it is not necessary because of your circumstances. Paul was the CEO of a financial planning firm. It was a company with 20 or more employees. When his wife turned 65, she reached that milestone before he did. They did considerable research. They really did their homework, and they realized that there were penalties if she did not enroll at the time she should. So she enrolled in Part A and Part B and stayed on his employer group health plan. However, the piece that she missed, because she was covered by his plan, she did not have to enroll in Part B. So between the premiums for Part B and IRMA, the income-related monthly adjustment amount that higher income beneficiaries must pay, they have overpaid to date $5,200, and that amount continues to grow. There is one other point, very important point, that many people do not realize. She may have jeopardized her future Medicare options, and this comes in with the guaranteed issue right to get a Medigap policy or a Medicare supplement. A person who is 65 and older and enrolled in Part B has a 6-month guaranteed issue right for the first 6 months that person is in Part B. Once she is in Part B for more than 6 months, her guaranteed issue right is gone, and her options may be limited depending on her health. So therefore, Part B enrollment is not necessary, and it's also not recommended. Second situation for employer group health plans, a company with fewer than 20 employees. In this particular situation, the company does not have to follow the same rules. The company can choose to exclude those who are turning 65 from the group plan. In other words, you turn 65, we have fewer than 20 employees, we're not going to keep you on our plan. And it's perfectly legal, and for small companies, that could be a cost burden keeping somebody on a plan who is turning 65. Now we have two twists in this one. If a Medicare eligible individual can continue with the coverage, so the boss says, no, we will keep you on our plan, no problem. That plan by law becomes secondary to Medicare, which means Medicare is the first payer, and the plan would serve as secondary coverage to pick up the cost that Medicare did not cover. If the individual can keep the plan, then that plan also, can be excluded, then you have to enroll in Medicare. So if the plan doesn't keep you, you would have to be excluded. If the plan will keep you, you would still have to do Medicare. So what I'm trying to say is either way, you can stay on the plan or you can't stay on the plan. Part B enrollment is necessary. And that brings us to our third mistake, which is not enrolling in Medicare when it is necessary. And here we're going to look at John. John worked for a company that had fewer than 20 employees. When John turned 65, his employer said that he could stay on the plan, so he decided to put off Medicare. He liked his coverage, the premium was affordable, he had dependents on his plan, and he thought, this is what I want to do. Well, the next year, the boss went to a workshop and learned that companies with fewer than 20 employees didn't have to keep these employees on the plan once they turned 65. And so the boss decided, well, we don't need you on the plan, and we're going to drop you from the coverage. Once John was dropped from the coverage because he didn't pay any attention to Medicare at age 65, he could not enroll in Medicare until January, the general enrollment period, and he would face a coverage gap and a lifelong penalty. He missed his chance to enroll in Part B, and consequently, he faced delayed enrollment. He cannot enroll until the general enrollment period, which I mentioned is January 1 to March 31st. Then there's going to be a gap in coverage because Medicare does not take effect till July 1. When we have clients in this situation, the one question I struggle to answer is, well, what am I supposed to do until July 1st? The company dropped John, and now he doesn't have any options. More significantly then, not only is he got the coverage gap, but he's going to pay for the rest of his life. John will face a late enrollment penalty. Now this penalty is 10% of the standard Part B premium that is in effect for the year, and it applies for every full year that a person misses the Part B enrollment. In 2017, the penalty amount is $13.40. John was probably about 1 year late, and so he will be paying an additional $13.40 this month. If somebody is 2 years late enrolling in Part B, that amount goes to $26.80, and so on, multiplying the number of full years that you are delayed enrolling. Now, this penalty amount can change every year, and it will follow the individual for life. Continuing with an employer group health plan at age 65, given the number of people that are working, some important points to note. Get documentation from the employer about the plan and the benefits if it's necessary. John should have gotten a copy of the policy, and then he might have had a better leg to stand on for what happened to him. Verify that the prescription drug coverage is considered to be creditable. Now, creditable means that the drug coverage, on average, will pay what a Medicare drug plan would pay. High deductible health plans present a risk because they are looking to save costs, and sometimes that will come in the prescription drug coverage part of the plan. If the coverage is considered creditable, the individual can delay enrollment in a Medicare drug plan and then will have a special enrollment period to get a drug plan once the person retires and decides to go with Medicare. If the coverage is not creditable, a Part D late enrollment penalty can apply, and that penalty also follows for life. Now, what many people age 65 and older who are continuing with coverage may not know is that by law, the company sponsoring their employer group plan must send a notice by October 15th about the status of prescription drug coverage. So this notice would say, yes, your prescription drug coverage is creditable, or no, your prescription drug coverage is not creditable. If the coverage isn't creditable, the individual can enroll in a Part D prescription drug plan in open enrollment, which is October 15th through December 1st. However, to be eligible, that person must be enrolled in Part A and or Part B of the Medicare program. Finally, for those who are working, if at all possible, they should start to take action 2 to 3 months before Medicare coverage is needed. So if an individual is going to be retiring in April, that person should start thinking about what to do with Medicare in the month of January or February. Medicare mistakes for those turning 65 and still working. That number is growing, and so I fear will the number of mistakes that happens. It is just way too easy to make mistakes with all the complexity. I compare it to putting together a jigsaw puzzle when you have 2 puzzles mixed into one box and you don't have a picture as to what the puzzle should look like. The mistakes can be costly and not fixed easily, if the mistake can even be fixed at all. So advice for your clients or for your family or yourself, no matter the situation, pay attention to Medicare at age 65. We have had people come to us, and at age 65, they did not realize they were that old. They thought they were okay because they had coverage, and then they found out about the mistake, something that they did not know. A person should consult with knowledgeable advisors, people who know what's going on. I know Medicare, but when I get asked questions about Social Security, I refer them to the Social Security experts. And finally, they should base enrollment decisions on the facts, not what somebody has told them, but actually what the facts may be. Turning 65 and still working presents challenges, but I think these simple tips may help to prevent some of the problems going forward. And so with that, we will address one final mistake, and I will turn that over to Melinda Coghill.
So just one final mistake. Not providing your clients with valuable Medicare enrollment guidance when they need it. So for all the financial advisors or other senior advisors out there, it's really important to recognize that there's a lot of seniors who are still working when they're turning 65. And there's even more seniors in general who need assistance at the age of 65 regarding Medicare enrollment. In fact, 3.6 million each year. 54% of these people say they do not understand Medicare well or at all, making it very likely they will make some sort of Medicare mistake. And whether it's picking the wrong plan, enrolling too soon, enrolling too late, as Diane had talked about, Medicare mistakes are expensive and can often follow a person for life. In fact, we did a calculation based upon the 65 incorporated clientele and determined that basically seniors are spending about $1 billion a year in Medicare mistakes alone. Why is this happening? Well, I think you've already figured a lot of that out because, quite frankly, Medicare has changed a lot over its 51 years. Unfortunately, the Medicare enrollment process has not changed much at all, requiring seniors to learn basically anything and everything they can about the Medicare enrollment process. When this doesn't work, where do they turn? Well, quite frankly, they turn to their most trusted advisors. Doctors, nurses, HR professionals, financial professionals. Ultimately, you guys haven't had the resources to really provide these people with the needed guidance either until now. Essentially, that's what I-65 does. I-65 empowers you to provide your clients with this key Medicare enrollment guidance. So Diane gave you a lot of information today. If you feel like, wow, that was completely overwhelming, how would I even remember it? The good news is, quite frankly, you don't need to remember it off the top of your head because with I-65 as a tool in your toolbox, I-65 helps you guide your clients appropriately and accurately. Essentially, Diane's brain is in this software program. So it provides your clients with guidance that's fast, simple, expert, and unbiased. And this allows you to basically become their Medicare enrollment hero. You can differentiate yourself from your competition, start conversations with people who might not otherwise talk to you, and prove without a doubt how you are saving them literally thousands of dollars in Medicare mistakes. If you'd like to learn more about I-65, please feel free to visit our website, www.i65.com, and sign up for a demo at /demo. Thank you so much for joining us today. We look forward to continuing to make these better each and every month and bringing you other new exciting Medicare enrollment topics. Have a great day, everyone, and again, thank you so much for joining us.